Okay, so I haven't decided yet whether or not I'm going to post this. Hang on, let me just turn the monitor down. But I thought I would do a video on my birth story. It was over a year ago now. When I was pregnant with my daughter, I was really nervous about giving birth, and I found that there were a lot of negative birth stories, and they made me even more nervous. But for someone who had never been through childbirth before, I really needed some positive stories, and I did find myself looking up a lot of birth stories on Reddit, YouTube, TikTok, and they did help, and I also found them really interesting. And with the likes of like my sort of birth, I had an induction. I would have liked to have known in more detail the sort of things that I may have gone through with this induction. There are a few different methods to induce labour. I had the pessary, but I will go more into that later on. So I was 11 days overdue. I actually went to be induced on day 10 of being overdue, like when I was 10 days overdue, and she arrived 11 days overdue. When I was 6 days overdue, I went to have a stretch and sweep. If you don't know what that is, you just go to like an appointment in the clinic. You don't even have to go to the hospital, and the midwife just sweeps around your cervix in the hopes to naturally induce labour. It didn't work. I was really hoping that it would work because I really did want to go into labour naturally. I had heard that inductions can be quite painful. I did do a bit of research online as well into stretches and sweeps, and found that for a few people it did work, but for a lot of people it really didn't work. So the day rolls around that I'm getting induced. We head down to the hospital for 9 o'clock in the morning. I had a hot chocolate in the car. I was really nervous. I got my fiance to put on a hypnobirthing podcast. Don't know why, because literally for the entire 9 months of my pregnancy, I hadn't listened to hypnobirthing. And it was at that point on the car journey, I knew that I had kind of fucked up a little bit, because I was like, oh my God, there's some really good takeaways from this. But right now on this 40-minute drive to the hospital, it's just not going to go in. So you really do need, the weeks leading up to the birth to kind of drill it in and put it into practice. That is one recommendation I would have for anyone who, wants to kind of learn more about their body during labour and birth, and apply practices that can make it more comfortable, hopefully. So we got there, I checked in, was taken to an examination room with my fiance by a midwife, and she was lovely. And it really does make all the difference when the doctor, midwife or nurse that you have is really nice. I have been unfortunately in situations, in like medical situations, where I've had a really abrupt doctor who hasn't been very friendly, and it really does make the experience horrible for you in a situation where you're already feeling very nervous. But she was lovely, and she went through everything, what would happen. She said that after, I was being admitted now, and I wouldn't be leaving the hospital without a baby, because I think in the back of my mind I was worried that I may go into labour, but I wouldn't be that far along, so they'd send me home, just because the drive was quite far, and I was worried that they'd send me home and then I would progress really quickly and we'd be too far from the hospital. I had the pessary, so it's like a little tampon. It is smaller, and I will say it feels quite scratchy. That's how I felt. And then they just place it up behind the cervix. I hate anything like that. I hate like invasive examinations. I've never been good with them. I don't know why, I just haven't. So I didn't enjoy that, but it was over really quickly. It didn't hurt, it was just uncomfortable, kind of like a smear test really. Yeah, so she told me that not to kind of get my hopes up too much, because it can take up to like 2 days for labour to even start, and I was like, oh goodness. I forgot to mention that during my stretch and sweep appointment, I was actually given a leaflet just about the pessary, just to kind of explain how it works, what it is. And it also mentioned, I'm trying to remember, I may get things wrong here, but it mentioned something about if it doesn't work within 24 hours, I think they go into different methods to try and get the labour going. And that you can also have it's possible to have quite a strong reaction to it, where they have to remove it, and that did end up happening with me, but I will again go into more detail in a little bit. Before I had the pessary put in, I was strapped up to the monitor just to check the baby's heartbeat and movements for half an hour, and then she placed the pessary in, And then she just said, took us to the ward, and we were basically free to do what we wanted around the hospital. So we decided to go for a walk. This is where I kind of like get confused with the chronological order of things. It's kind of all a blur now when I think back to it. I did actually forget to mention that when she was like placing the pessary, she said that, obviously she said that it can take up to 2 days for labour to kickstart. But honestly, I kid you not, within 5 minutes of having the pessary put in, I started to get like really mild cramps. And I did mention this to her, and she was like, oh yeah, no, it'll be too soon to be anything to do with that. But plot twist, it was labour. So then she took us to the ward. She kind of just said like, you can go off and do what you want, obviously stay within the confines of the hospital grounds. So we got to the ward, had a bit of lunch, and then we decided to go for a walk. So we just walked around the hospital grounds, came back. So there was one other woman who'd been like admitted in the bed next to me, and there was a woman in the bed opposite me, and she was having a really loud conversation on the phone, and I could smell something sweet, and I had a feeling that I knew what it was. So basically, like throughout my pregnancy, I had this huge paranoia with anyone smoking around me when I was pregnant or vaping around me, just because of the chemicals. Don't want to be exposed to that when I'm pregnant. I don't want anything to go through to the baby. So I kind of had like a suspicion that she was vaping, and I was thinking, surely not, like she's pregnant, we're on a maternity ward, you're not allowed to do it indoors, surely not. I heard the telltale like sign that it was probably a vape, you know, that crackle when they inhale from the vape. Yeah, I heard that, and I did mention it to my partner, and he was kind of like, he heard it, he smelled it, he was like, yeah, I think you're right. So we went to find a midwife, and I let her know, and I just said, look, I don't want to cause like a problem or anything. I don't want her knowing that I've said anything, but this is what's happening. I think my partner might have, I don't know if he said it to her. He advocated a lot for me during that time. I have to get some water. The midwife was kind of like, oh, she kind of basically had said that it actually happens more often than you think. Obviously it shouldn't be happening. And unless like they have concrete, I have no light anymore. She basically said that unless they have concrete evidence, they can't really say anything, like unless they physically see her do it. So, I mean, that was kind of annoying, but like it was what it was. And she asked me if I wanted to move to another ward, and I immediately said yes, please. So I moved to another ward, it was all fine. And then we decided to go for another walk. My partner had some lunch in the cafeteria. And that is when I kind of noticed at that time that the cramps were really starting to intensify. Things were getting quite difficult physically. And we did go for another walk after this. By this time, it was about 1 o'clock. So I'd had the pessary replaced by about 10 o'clock. So 3 hours it took for the cramps to really kind of kick up a notch. Walking got too much for me. I said, look, I have to go back. From 10 o'clock in the morning when the pessary went in, to 10 o'clock at night when I actually ended up getting an epidural, I didn't have any medication. So from 2 o'clock in the afternoon to 10 p.m, I was in agony. And I do want to say that this actually isn't a negative birth story, it's actually a positive birth story, because it all ended fine. But the induction was painful, like contractions painful. Once I had the epidural, I didn't feel any pain, so I hope that's a reassurance. I don't think my body responded very well to the pessary, just because I think it responded too well. I feel like had it not been induced before, I would have actually gone into labour naturally. I think that could be why it all happened so fast. So from what I'd heard about labour is that you would have a contraction at the very start, and then you might not have one for like 20 minutes, and then you'd have another one, lasts about 90 seconds, ride out the pain, and then you're kind of okay until the next one comes along. But honestly, I didn't have any long breaks. Mine were just happening back to back. So I was having a contraction, so painful. And I think the longest I went without having one was like 2 minutes. Like in that whole 12 hours, 2 minutes I would have like of relief. And then it would kind of come back. Like towards late afternoon, I was honestly getting them like probably 30-second break, maybe a minute at a push. So I was finding that like I was having no reprieve. I was finding that like one contraction would end, and then I would only just be starting to like gather myself again, and start to feel okay, and then the next one would just, so that was difficult. I just want to kind of like paint a picture of like just how like crazy the induction was. So I had all this pain, I had these crazy contractions, and honestly within the 12 hours I only progressed to 2-3 centimeters dilated. It was crazy. I did call the midwife a few times during the 12 hours just to be checked, because I was kind of very hopeful that I was dilated enough to have the epidural. They wait till you're 4 centimeters dilated, I think. This was kind of surprising to me. I never knew this, but she kind of said to me, we will check you, but we don't kind of want to do it too much because there is like a risk of infection. I think it's just because obviously it's an internal examination and just the risk of transmitting bacteria into the cervix. So I got taken to an examination room. Like I said before, I am so bad when it comes to any like invasive exam. Like I said before, I don't know why. And I had to have gas and air to have the examination done. Just want to say, some people hate gas and air. It's the best thing I've ever had. It didn't take away the pain or anything like that, but just the feeling like that it gives me, like, yeah, I really enjoy it. I was only like 1 centimeter dilated at this point, which was crazy. The rest of the journey is a bit of a blur. It was just literally the pain increasing over the 12 hours, calling the midwife over again a couple more times. I think I got checked one more time, had progressed to 2 centimeters. And they kept saying to me that there was an option to take, I think it's pethidine. I can't remember if that's what it's called. I'll have to double check. And it's like an injection that goes into your thigh or your bottom. But I was really on the fence about having it because you have to have it, I think, at least 4 hours before you actually give birth, because there is a reason, and I don't want to kind of say what I think it is because I'll probably get it wrong. Maybe I'll insert it here. Yeah, I decided not to have it at that point, and like all I wanted was like, oh, you know, you're doing amazing, like I know it hurts, what can we do for you? But obviously like they're not gonna, well, some may be like that, and if you have a midwife like that, you're very lucky. But I just find that they were very like, oh yeah, no, there's nothing we can do, you know, it just means like, you know, the labour's kind of going ahead. They kept saying I wasn't in active labour, which was like crazy to me, because even though I know they were right, like they know what they're talking about, the pain I was in, I was like, how can I not be in active labour? Obviously they deal with women in labour every single day and night, and like you're in pain when you're in labour, so what could they do? This next part, I've never actually heard anyone talk about this. This is the part that gives me the most trauma when I think back on the whole experience. So your partner can only stay like in the hospital that I was in anyway until 10 p.m. I remember the day kind of progressing and I was just feeling so helpless. It's like a pain that I'd never felt before, and I was just getting hysterical because I couldn't face doing it alone, in the bed alone. I didn't want him to leave, and I was like, what am I going to do at 10 p.m. when he goes? And I'm barely getting any comfort with him here, not because he wasn't a comfort, but because even with him like playing with my hair, which he was doing, which I absolutely love, you know, I wasn't getting any relief. And so I was literally in tears. I was like, I don't want you to go. I don't know, I can't do this. The classic line, I can't do this. My daughter's woken up, hang on. He just got to a point where my partner was like, look, just consider taking pethidine. If it's going to help you, you need to have something that's going to help you. And I kind of just got to the point where I was like, look, okay, I think I am going to have it. I do remember actually there was another reason I was scared to take it. I think I had been Googling, like literally in the hospital bed, side effects that people were having with it. I can't remember. Again, like I may put them like up here. But yeah, I was just really like, I don't know how I feel about that. But I called a midwife anyway and I said, look, I want the pethidine shot if that's okay. And thankfully, like they'd done like a shift change, and this midwife was so nice. And I'd actually had it before. When I was like 20 something weeks pregnant, I went in to get something checked in the labour ward, and she was the one who did it. And she was from like, I think she was from my hometown as well. And that was something that was really crazy that we'd like discovered the last time I was there. She was like, okay, look, I'll check you, like we'll give you the pethidine shot, but let's just check baby first. So she brought the monitor over, and I don't know why this hadn't happened before, but she basically hooked me up to the monitor, and my baby's heartbeat was quite fast. She was like, okay, the heartbeat's quite fast. I think we need to bring you to the delivery room just so we can just monitor it. And it was literally like 20 minutes to 10 in the evening. So my partner had to go in like 20 minutes from here. I was like, Christmas came early. I was so delighted because when the partner, like when you go into the delivery room, the partner doesn't have to go home. Because once you're in the delivery room, you're basically there till you have the baby. So I got into the delivery room and like at this point, I literally could not speak. I was in so much pain. And they got a doctor to come in. She was quite abrupt, but like in the end, she was the one who delivered my daughter. And you know, she was like really nice at the same time. But I think doctors like have like a way about them that their bedside manner is more like firm a lot of the time, I found. Whereas a nurse or a midwife are kind of more like nurturing. She was like, you know, I have to examine you, you're going to have to let me examine you, yada yada yada. But I think she saw like with every contraction that hit me, like literally back to back, I think she actually just saw how much pain I was in, and she was like, look, we're not meant to give you the epidural really until you're 4 centimeters dilated, but I have made an informed decision, I'm going to give it to you. And I was like, but I thought like, but aren't you meant to wait until you're 4 centimeters? And she's like, yes, however, I've judged the situation and I honestly feel like it is in your best interest to have it now. They got the anaesthetist in, I can never say that word right. They got him in and he performed the epidural. It felt like it only took about 10-15 minutes, but my partner, like he wasn't allowed in the room and apparently it was like half an hour. I had heard stories about epidurals, a lot of failed epidurals, but honestly, the guy who did mine, I will never be able to thank him enough. He did an incredible one. I actually lost complete feeling in one of my legs, which I don't know if that's normal or not, but yeah, it worked, let's just say, and all the pain went away. And my partner said I was like a different woman when he came into the room. I had my daughter the next morning, so I was laboring overnight. And I could tell when the contractions were coming because I could feel like a tightness in my uterus, but it was just mad because like there was no pain at all. And they told me to get some sleep and I tried. My partner got some sleep on the chair, but I just couldn't sleep. And like, I don't regret anything. I don't regret getting the epidural, but I kept like, I felt a bit panicked because I couldn't feel obviously from here like down. And just the feeling of not being able to feel my legs, I just felt quite panicked. I was like, what if I'm like paralyzed from this? Because that was the fear that I had. What if I moved when they were inserting the epidural, or what if it caused nerve damage just in general? So that was something I was quite nervous about because like, even though like, obviously the needle, I think they just feed a tube through, I don't know. Do you know what? I'm not a doctor, so I shouldn't be explaining this. But I know that like the tube stays in your back or something. There's something that stays in your back, and I was really paranoid of like lying on it. I just wasn't comfortable in my position, and I couldn't move over to the other side of the bed without like being helped. Because it was such a good epidural, I just couldn't move. So I really didn't get a lot of sleep, and I'd be scrolling on my phone, and the midwife would come into the room and they'd be like, get some sleep. You're going to need it when you're pushing. A couple of hours later, the midwife came to check me, and honestly, the cervical examinations from this point on were a breeze. I had actually like progressed to like 6 centimeters or something, I think, at this point, and she was really shocked. Because she was like, I wasn't expecting that. And I think basically we'd come to the conclusion that because I was so distressed and in pain, it kind of hindered the dilation or something. And they do say that when you have an epidural, it can kind of slow things down, but like in my case, it was speeding up. Another thing I forgot to mention is that they did take the pessary out. The doctor said that she thought I was having quite an adverse reaction to it. So they did take it out, like, you know, before they broke my waters and everything. 5 or 6 o'clock in the morning came. It was probably about 5, half 5 in the morning, and she checked me and she was like, you're 10 centimeters. And she told me at this point that they don't get you to push immediately. They like to kind of wait for about an hour to let the baby like drop further through the birth canal naturally. However, my baby's heartbeat was quite high again, so they had to deliver her fast. At this point, they got the doctor back in the room, but of course, in typical style, my contractions began to like stop when I had to push. And if you didn't know already, you can only push through a contraction. So I had to have like the hormone drip, I think it's oxytocin, can't remember. So they had to give me that. They had to give me paracetamol and a drip because I had a couple of midwives in the room with me at this point. One of them thought I was getting a bit of a temperature. This was actually like an hour before I was pushing, I think. This is what I mean when I say everything's quite hazy. I don't remember the timeline of everything. It was honestly like a fever dream. It was quite difficult. Like, it took a lot in me. I got like loads of like what looked like hickeys on my neck, like after I gave birth, because I popped that many blood vessels from pushing. In the end, like, my daughter's head was lolled to the side when she was in me, so they did have to intervene, like medical intervention. So I had an episiotomy and a vacuum delivery, and I had like seen and heard things about that as well. And I remember saying to them, like, I'd read online that they can only try and suction the baby out like 3 times and then they have to give up and use another method. And I said this and they were like, oh, I can't remember what they said. This is why I shouldn't have waited a year to do this video. But they were like, yes, but this is this and this and this. And they were like, stay off Dr. Google. They managed to get her out anyway with a suction cup. I got to hold her, have skin to skin for a couple of minutes. And then they actually did have to take her away to be put into an incubator for a few hours just because her breathing was quite fast as well. Her heart rate was quite fast. I just said to my partner, I was like, do not let her go alone, just go with her. So he went with her. And then I was like stitched up and everything. It was like their pages kind of went off for another emergency and they kind of had to run out for a bit. I think they had to go into like theatre for someone's C-section. So I was kind of left there. Like after giving birth, obviously like they'd already delivered the placenta and everything at this point. But I was kind of like, I think I was there for like 10, 15 minutes, maybe 20 on my own. And I remember just feeling really vulnerable. And something else I forgot to say that after I gave birth, I don't know if it was just like how tired I was. I really hadn't slept properly in 2 days. Even like before I came to the hospital, like at home, I hadn't slept very well. Overexertion from pushing, just being in so much pain for so long, and probably the hormone drip. I was like vomiting loads into a plastic bag after I gave birth, so that was hard. My daughter ended up being fine. Honestly, she was great. She was like a really good weight as well. And yeah, like after being in the incubator, she was absolutely fine. So that's basically my birth story. Like I was okay, like recovery with an episiotomy. It was a little bit rough, but I got there in the end. No complications really. So yeah, that was my birth story, and honestly I would do it all over again. That is just me trying to say that despite all the pain I was going through, like, you know, it is something that I would do again. And I now understand what people mean when they say that you forget the pain. Like, I actually can't remember what the pain of the contractions felt like. I know it's like period pains ramped up to 1,000, if not more, but like I can't remember how it felt. I just remember it was painful. I will say I remember the first night after I'd given birth, I was staying on the ward. Another woman came onto the ward, and at like 3 a.m. she was like proper going into active labour. And I remember thinking like, oh my god, how like I was getting like PTSD of like when I thought I was going to be by myself, because she was by herself. And I was like, how is she like, how is she feeling right now going through all of that, and her partner's not even here? And yeah, I think that would be something I'd really struggle with like the next time around, is like if I had to labour alone. But I don't know, look, I'll cross that bridge if I come to it. So that was basically it. I just want to say that if anyone is nervous about giving birth, like don't be, honestly. Obviously everyone's birth is different. Some people do have traumatic birth experiences. They did tell me some have easy breezy births. I don't feel like mine was necessarily traumatic. They did keep saying to me it was a difficult birth, and did I want to talk to someone because it was difficult, but I felt okay about it. Yeah, like I was so nervous and so scared to give birth, and I'd seen all these like scary stories online, and I was just so scared. And mine wasn't easy breezy, but I got through it, and I'd do it again. Like it was manageable. So that is basically my story. I hope that it was informative to some people. I hope it was reassuring to others. Yeah, anyway,